can't stress that enough. You should know about congestive heart failure. Okay, altered mental status, stroke, and headache. Altered mental status, know the causes of altered mental status and how you can treat those in the field, the ones that you can. Headache, know the different types of headaches, tension headaches, migraines, what causes them. And then strokes, you need to know the different types of strokes and the presentations of the strokes. And the, Cincinnati stroke scale when it deals with fast.
Do you need no laps?
No.
Okay.
Okay, keep it simple. We won't fast. Keep it simple. Because regardless of what hemisphere it's in, our treatment's gonna be the same. As you go through your EMS career, if you wanna get more knowledgeable and go to LAPS and go to advanced stroke life support, then I would suggest that. But starting off at this level, no. Because again, quick signs of recognizing stroke is gonna be important because again, time is brain at this point, so we gotta get them to definitive care. Seizures and syncope, chapter 19. Know the different types of seizures. So you're talking about absent seizures, fatigue seizures, grand mal seizures, focal seizures. Know the different processes of a person and what they go through. Do they have an aura or don't they? What's the tonic-clonic phase and what's the postictal stage? And then for syncope, know the different the different causes of syncope and the pathophysiology behind it. Now, I'm going to forewarn you now, part of this exam is going to be multiple choice, part of this exam is going to be listing, and part of this is going to be an essay. So there'll be an essay question like, for example, you have a 65-year-old male who's found, let's say, beside his toilet after a syncopal episode. What is your thinking process behind what caused the syncopal episode and why, and then what is your treatment? So, if you think about little old people and they're sitting on the toilet, one of their major problems is constipation. So they're going to be straining and, okay? When you hold your breath and strain and bear down like you're trying to get the poop out, what happens is that you increase the vagus nerve and increase that tone, and that causes them to pass out. It's a vasovagal maneuver, okay? And that's what causes them to pass out. Is that the only thing that could cause them to pass out? No. What else can cause a little old person to pass out? Drop in blood pressure. What
Drop
else?
in blood sugar.
Drop in blood sugar. What else?
Right, if there's fluid
Shock.
present in their
Cold.
stool,
Say that again.
if there's fluid present in their stool,
Mm-hmm.
if they're
Everything
passing
going on.
blood.
Passing blood, maybe. Okay. Well, I can go with that. GI bleed of some flavor that's been going on that they may not have known until then. What were you gonna say, Earl?
Oh, this thing like lack of blood. too.
Yeah, lack of blood. Okay, so maybe it's the fact that they took an overdose of their medication because they couldn't remember if they took it, so they took an extra dose. And if they're on like a water pill or something like that, then there's going to be a massive interstitial fluid shift that could cause them to pass out, which again, drop in blood pressure type thing. And then what's your treatment?
based on what it is, we wanna get, if their blood
I
pressure
mean-
drop, we wanna get their blood pressure up.
Okay, how do we do that?
Probably wanna give them some type of oxygen.
Okay, so oxygen therapy and, go ahead,
Probably wanna
Amon.
give them some kind of medicine that stimulate their,
Well, I was just gonna say, if you can get them to wake up, give them blood sugar, or not blood sugar, give them, glucose.
Well, you have to check it first to
Yeah.
make sure that that's a problem, but there are some things that you can fix, right?
Mm-hmm.
What's the treatment for someone just with a generalized syncopal episode?
Sitting them upright.
Lay them down. Okay, non-invasive, if you're thinking hypovolemia of some flavor, then put their legs up, put them in Trendelenburg, as long as they haven't hit their head or anything like that, put them in Trendelenburg. Keep them warm, okay, and then you treat what you find, so if there's low blood sugar, then we'll give blood sugar. We wanna give them some supplemental oxygenation, okay, so these are some of the things that you can fix in the field. Okay, other things like a massive interstitial fluid shift secondary to a drug reaction or a side effect, that's something that your advance will have to take care of, but you get my drift of where we're going with that. Be able to explain ventilation and be able to explain respiration. Specifically, what changes from the intrathoracic pressure. You have to understand how things work. Keep in mind also that inspiration is a active process and exhalation is a passive process. Why are we concerned when both of those become active?
You're burning more energy than you need to.
Burning more oxygen, the increase in oxygen demand goes up, now you're increasing workload of the heart. Okay, you see where this is going? So this is where what I'm saying as far as concepts are concerned. Okay, chapter 20, acute diabetic emergencies. Know the differences between hyper and hypoglycemia, how to do an AccuCheck and the treatment thereof. So again, your drug cards is gonna come in handy. Understand type 1 and type 2 diabetes. Anaphylactic reactions, chapter 21. Understand the difference between a local versus a systemic reaction and what happens during a systemic reaction and why it becomes so deadly. Yes?
Systemic is like an anaphylactic.
That's full-blown anaphylactic, yes.
Okay.
So you need to know what exactly happens during that systemic reaction and why it's so deadly. There's several things that happen. There's an increase in capillary permeability, which means that fluid is now leaking out of the capillary bed.
Cause an infection or something.
Okay, so remember that a normal capillary bed is nice and tight, and it allows one single cell at a time through the highways. When there's an anaphylactic reaction, it stretches, so now we're losing fluid into the interstitial fluid, or interstitial spaces, okay? So this is what I mean by capillary permeability, is the fact that now that capillary bed is stretching, overstretching, so now we're losing fluid into the interstitial spaces, and now more, that kind of decreases the amount of volume coming through the capillary bed at that point. Do we have bronchoconstriction or bronchodilation? Major constriction.
And the blood vessels dilate.
Okay, blood vessels dilate, which means that there is no more sympathetic nervous system inertia at that point. That's how come everything stays vasodilated,
It's depressed.
which then causes a secondary effect, which is shock or hypotension. Okay, which means that when it causes the hypotension because of the vasodilatation, then that means there's a huge, significant decrease in cerebral blood flow. This is why you do what you do and you assist that patient with their EpiPen or whatever happens in the back of that ambulance happens in the back of the ambulance. So if they can't do it because they're so weak and they're uptight, then you're gonna have to basically, just put their hand.
Hold their
on it.
hand.
Assist, okay? Alright? So do you understand why we give epi? Epi is a sympathomimetic, which means it mimics the sympathetic nervous system.
It'll also.
So we're trying to kickstart their system by giving epi in the form of
Activates
an
alpha 1
injection.
and 2 and beta 1 and 2.
Make sense?
Yeah.
This is what I'm talking about. Can you explain anaphylaxis to me? Just saying. Can you explain anaphylaxis to me?
I guess, trying to explain what happened.
That's exactly what,
So when are we taking the written exam?
next Thursday.
Oh.
Next Tuesday is all your skills. Ask the question, I'll see the question mark.
Yeah, I was gonna ask, it's the reactions of different hormones, the neurological reaction with alpha 1, beta 1, beta 2, but then it goes through not just norepinephrine and epinephrine, but some other ones, and we didn't need to know those other hormones as well and their effects?
Okay, so the only things that I want you to know, okay, from the sympathetic nervous system standpoint, the two neurotransmitters, or whatever you wanna call them, is epi and norepi.
Okay, so you're surprised.
From the parasympathetic is acetylcholine, okay? So you have to understand, the sympatho is going to increase everything from the CNS part, and then the acetylcholine kind of brings everything back to homeostasis. So those are the two or the three types of neurotransmitters you need to know.
The other ones that I think it was like vasopressin and a couple other things,
Don't be concerned about those right now.
it was all sodium reintegration and stuff like that.
Yeah, because of the sodium potassium pump,
Yeah.
okay, because, that plays an important role. So you kind of need to understand the two, epi and norepi, they work in conjunction with the sympathetic nervous system, and then acetylcholine for the parasympathetic. So whichever innervation is higher, you can imagine what's going to happen. So if we're like this, then this is gonna have to have a lot more innervation, this is gonna have to decrease in order for them to come back to homeostasis, just vice versa too. So kind of understand that, and you'll be fine, okay? Okay, so toxicologic emergencies, what do I need to say about that, okay? Say it again,
4 route,
the 4 routes of how a poison can get into the body?
and it says the benefits of poison control.
Yep, please understand the benefits of poison control, they're gonna be your best friends in a toxicological emergency.
Well, I added to
All right,
it.
know about, is sludge mentioned in your book with the organophosphate poisonings? I can't remember if it's in this class or,
Toxicology?
yeah. I wanna say that it is, that it mentioned, organophosphate poisoning and the fact that your body goes through sludge.
I remember cyanide, carbon dioxide, things like that, what they do. I don't remember.
Okay, because there's an actual Mark II kit that we carry for organophosphate poisoning, so I couldn't remember if it was here or in the advanced class that,
That's in our scope?
I don't think it's in your scope, but the ambulance services will provide that to you.
Call MD and go, hey, what do I do
Yeah,
with this
yeah,
thing?
yeah,
What is
yeah,
this?
So does that mention,
What's it called?
it's called
Sludge.
sludge? And it's under organophosphate poisoning? And it should be salivation, lacrimation, so urination, defecation, gastrointestinal, and emesis.
What, do you know if it's like absorb, inhale, injected? No?
Might have the
It's gonna
index
be,
from the
what part of the book? What chapter are you in?
Oh,
Oh, you're already there.
No.
This is toxicology, it may be under environmental.
Oh, environmental measures?
Yeah, check in,
That'll be 24.
okay, environmental's gonna be hypothermia.
26. It's 70 questions total. It's either 70 or 80. Like it's, yeah, with the pretest as well.
For all four, it's always only one chapter?
It's only one chapter.
Yeah.
Just 26.
Knock it out this afternoon.
Huh?
This Thursday we got through some.
24 or 25.
Yeah, it looked like it was two.
Oh, well. Oh, so 24, 25 would do Tuesday?
On
Or Thursday?
Thursday.
Oh, okay, well, I already did that one.
Okay. and it's
24 is
not-
short, 25 is long.
It's not in your book, no,
Already
okay, so
finished
it's in the
24,
advanced book, I'm
25.
sorry. Like, sometimes I overlap too.
I was wondering, I hadn't seen it.
Okay, so a couple of toxicologic specific emergencies, know about cyanide and carbon monoxide, because that's the two that you'll kind of see. Also about alcohol and intoxication. Know the difference between CNS depressants and CNS stimulants, okay? I don't want you to go into a whole lot of details about that. You'll see a lot of crack cocaine, meth, heroin.
Smack.
Carbon monoxide.
So I don't want you to worry so much about toxicological. Abdominal, hematologic, gynecologic, GI, GU, and renal. Let me borrow your book. I don't remember the page.
What are we, 23?
Chapter 23, okay, know the abdominal structures and their 4 quadrants and what's in each. Obviously, you need to know what's a hollow organ versus a solid organ. Know the difference between visceral pain and parietal pain.
So the 30, is that the same as the 30 and deferred?
So what was it, parietal and what else?
Visceral pain and parietal pain. Now, visceral pain is more referred pain, but again, know the difference between the two. One is actually because of the organ itself, and then the other one's so diffuse that it's very hard to pinpoint.
So, you had told us last time, like, referred versus deferred, but I couldn't find deferred in the book.
Did I see deferred?
Yeah.
Okay.
But I couldn't, I was just saying, like, can you give us like a, no, deferred.
Oh, different.
Yeah, I
So
couldn't find it.
scratch out deferred and just stay with referred
Okay.
pain.
Also on the recordings, I think your heat exhaustion was like 20 something seconds.
Oh, yeah, there was.
Was it?
Yeah.
Yeah, one of them was like short.
Awesome, okay. I'll have to go back and check. Did everybody get did y'all listen to the recording? I'll try to keep
Yeah,
it
I
short and
went through it,
simple,
I'm like, what
kind of
is-
straightforward. Okay, so I'll have to
I
go.
felt like you were meant to go on after that point, that was a really brief, like,
One of them,
this is heat exposure, okay?
Okay.
One of them started and then just cuts off, and it's just silent.
The whole, oh, yeah, okay, yeah.
You know
Okay,
what I'm
I'll go
talking
back.
about. Yeah,
I'll go back
one of
and
them,
check.
and then I mean, it was you broke it. It was that when you broke up. I can't remember the title of it,
Okay.
but yeah, it just you started with like a sentence and then it just went dead silent. And I'm just sitting there. I'm like, "Is something? Is it me?"
So I'll have to go back and check those out. Okay. Thanks for letting me know.
No problem. Oh God.
Okay. Dang.
So I won some money on a scratch off. I won some money on a scratch off, and then the next day, my battery goes dead.
Yep.
Okay,
So I was like, "Yep."
a great table in your book, 701 at the bottom of the page, that's causes of acute abdominal pain. So anything that's got itis behind it is gonna be an inflammation of. So you need to know the different organs that can get inflamed. Please kind of highlight and mark cholecystitis, you will see that again. That's inflammation of the gallbladder, that's been on several of the EMT National Registry questions, so note cholecystitis. Not saying the other ones are not important, but just kind of for future reference. What's the other one? Oh, that's what it is. Okay, so know the difference between the triple A. And a triple A versus an aortic dissection. The presentation's gonna be slightly different as far as the description of that particular pain, so know that, that's on page 706.
Triple A is an abdominal aortic aneurysm versus the.
Transition like it's here.
Exactly. Okay, so as far as your hematologic, no sickle cell. Okay. Deep vein thrombosis, we need to know. Gynecological emergencies, okay? On page 716, you'll need to know what middle schmerz is, okay? That's
What
the-
page?
716. Okay, that's pain with menstruation. I'm sorry, that's the pain in the middle of their menstrual cycle. Okay, know about pelvic inflammatory disease. And then there was okay, GIGU, renal conditions. Okay, no kidney stones, know the terminology for that, that's renal calculi, caliculi, however you wanna say it. Understand about kidney failure and why patients are on dialysis. Okay, so the last couple of chapters dealt with environmental emergencies. Again, know about cold,
No, about.
hypothermia, and then the mechanisms of heat loss. So you're talking radiation, convection, conduction, evaporation. That's found on page 731. So know the different ways that heat loss can happen in an individual. Okay, know how to treat someone who's hypothermic. And then the heat part, okay, hyperthermia, understand, definitely highlight the difference between heat exhaustion and heat stroke. Okay, heat stroke is more the life-threatening, kind of can kill you type thing, so understand heat stroke and heat exhaustion and the difference between the two. What? Okay, so bites and stings, just be aware of the different types of biters bite, the spider bites, the black widow versus the brown recluse. What you do if you should happen to see a stinger in the skin, how to get it out properly and appropriately. Again, anaphylaxis is kind of reincorporated back here because of the fact that some people go through anaphylaxis. And then I'm gonna stay on this for just a second. Lightning strike patients. You need to understand what happens when lightning strikes a patient, okay? You have a lot of issues going on. Our top priority at this point when lightning strikes somebody is the electrical conduction of the heart, because one, lightning can actually completely knock it out or actually put it into a lethal dysrhythmia. Okay, and then you have some of the other secondary and tertiary effects in the fact that it can cause fractures, it can cause blowout fractures. So lightning's nothing to play with. So you need to understand the assessment of a lightning strike patient and what things to expect. And then your care. Okay, so acute mountain sickness, high altitude sickness, just know about it, okay? Understand the reasoning behind high altitudes is the fact that the air is much more thinner, oxygen is not as heavy or weighted, if you will. Submersion incidents, as far as drowning and diving incidents, obviously you need to know, why a patient drowns, okay? Not just because of the fact they can't swim, but what happens physiologically. Now, how many of you heard of dry drownings? Have you ever heard the term? Do you understand what happens in a dry drowning?
Is it like on the lungs or something?
Yeah, there's a lot of-
I mean,
Go ahead, what were you gonna say, Joseph?
No, yeah, it's lungs, I would imagine. Is it when particles fill up the
Okay.
alveoli?
So, this is what happens, or at least the concept between dry drownings. So, let's say you're at a water park, and how many of you have parents that threw you in the water and expected you to swim, and just encourage you, hey, kick your legs, kick on, okay?
Figure it out was what I got.
Okay, so when a child, we'll say for instance, has an adult who throws their kid in and says, kick your legs, okay, so during this process, the kid's drinking water, if not aspirating water. Every time he gets thrown back in, okay, so he's intaking water and partially aspirating water. He doesn't drown then, it's whenever he goes home, takes a shower, eats, and then goes to bed is when the drowning actually occurs, because whatever he aspirated and whatever's in his lungs is now gonna start pulling more fluid into the lungs. Okay, normally when people drown, they don't have a lot of water in their lungs because of the massive spasms that your larynx goes through in order to cut off the trachea. So basically you asphyxiate before you drown. So with a dry drowning, okay, there's not a whole lot of spasms going on. They're just drinking the water, if not aspirating. Now, that's how come when kids come up out of the water, they start coughing, is because they have now swallowed and aspirated some of the water. And then the actual drowning occurs after they are actually back in bed, laying down, sleeping, and it happens during the nighttime. Okay? So understand drownings. Diving accidents, again, unless you've been trained like a mom to be a lifeguard, and that, again, your preference, but we're not trained to do water rescue. We're not. So ensure that if you have a drowning or something like that, that's like at the river walk or something like that, you call the proper people. And I'm here to tell you, between us and the people across the bridge, they're gonna argue whose side and who's gonna respond and stuff like that. And so by that time, they're already swept down because you're not gonna go jumping in there. So Muskogee County is claiming it's Phoenix City or whoever, and then the Phoenix City is saying it's Muskogee County, and they're just going back and forth, and they've been in a riff ever since.
That's so crazy, why y'all just all wanna go and help?
That's what I say, dang, I mean, what do you know?
Way down in the water, bringing extra pair of clothes to work with, you know?
Yeah, so, again, and that's a lot different at a river walk where you have water rapids going on versus a swimming pool or something like that. So,
If it's like steady water out of Lincoln, I gotta wait out to go get someone, I'm going to get somebody, but if it's, yeah.
These are
water
Okay,
rapids-
These
so-
are
oh,
the
down by the
highest
river
class
walk, I mean,
rapids in
there's some of the
Georgia.
places that's pretty,
Highest class
Dang.
rapids
Yeah.
here in Georgia.
Well, that's what I'm saying,
Yeah.
those are not something I would go into.
No, yeah.
I'm not in a moving action hero.
okay,
You're not
so
Tom
you
Cruise,
gotta take
man.
into consideration, the things that's presented to you and call the necessary resources, and unfortunately, yeah, you're gonna stand and watch someone drown. Unless it's a type of situation where you're willing to take the risk, like in a swimming pool or something like that, I mean, I'm sorry, but I wouldn't be able to pull somebody out. A kid's a different story, okay, but not a grown adult like myself, I wouldn't even know where to begin on how to drag them out of there. So unless you've been properly trained, don't attempt it, because you could be drowning with them or,
Actually,
Floating
basically,
with
it's not
them.
that far off.
I know.
okay.
Just two arms up here and then you just hug that shit.
Yeah, so, and then you have those people that are actually in the process of drowning and they're kicking and they're freaking out and they're swimming out there. Okay, I talked to one of the lifeguards or one of my lifeguard friends, and, you know, they have much to worry about when you have someone who's kicking and, you know, wailing and things like that, and I'm not sure if this is true or not, but I'll just have them on kick in. But it's my understanding that my actual friend lifeguard who had a wailing person who was drowning actually pulled him under and then pulled him back up together. If not, they'll be grabbing all over you and pushing you down, kicking you down and stuff like that, so it's just better to go up underneath them, pull them down, and then he actually got up underneath them, hands up and
That is-
around the neck and then
that's
brought
a-
them up, so.
I don't know if they still do that, but that was definitely an option. I mean, I've been told, you know, just take a tube and bop them one good time. Cause it's just a giant, it's really just a big pillow. That's
Yeah.
really what it is.
Yeah.
So if you bop them, they're just gonna try to figure out what happened.
Okay.
Or usually,
Well,
what you're supposed to do is you're supposed to come behind them,
Pillowback.
and then you just come behind them, and then you just scoop them in like that. You just literally just, if you can't, you know, just grab them one and slide it under. That's your
Gotcha.
only
Okay.
3 options.
So, you know, there's options out there, but again, I wouldn't know how to do it,
I
so.
wonder if we carry any kind of other like equipment on the truck, like do we carry rope? Can we throw
Yeah,
something
there's
out?
a thing in here, it talks about you're supposed to like, well, not, it wasn't this one, it was
Yeah.
one of the trainings talking about throwing it underhand
A
and
little bit
stuff.
of
I was
rope
like,
goes a long way.
Yeah, no.
I feel like that's a very expensive flotation.
Well, we don't
device
carry
to
rope,
be
we don't carry
thrown around.
flotation devices, we don't carry a lot of that stuff. Okay, and then if you have read the chapter over drownings and stuff like that, if you're the one going out there to rescue, you are to assume that they sustained a neck injury. And so that just complicates it, because you immediately need to flip them over, but at the same time, you've gotta maintain C-spine when you do it, and then start resuscitating measures that way until a backboard gets out there, but again, we're not trained to do that.
Who gonna do all that? We
It's
just
not
tell
hard.
you,
If
get
they're
your own
face
leg
down,
and
you
save
take one arm here, and then you rotate yourself under with them right here. So basically, your head and their head are just gonna be
Are
sitting
the
above the
same,
water, and then you're
right.
just walking around in a circle, keeping their spine straight until someone comes in and slides the backboard right up under it, and then they're just sitting there.
So,
It's not
again,
hard, it just looks complicated.
Yeah, so again, I mean, that's just one thing that we're not trained to do. Now, if you do that separately on your own or something like that, that's different, but again, we don't.
I do have questions about that, like how Amon is trained to be a lifeguard. Is he allowed to do that on duty and still be considered under his scope of practice?
Protocol.
Like if I got, certifications to do certain things, am I allowed to do it while I'm at work? No, you have to do.
That's all gonna be dependent on his medical director of his service.
If she tells
Just
me.
like if, okay, cause again, a medical director can technically override what an EMT can do. So if you had, let's say, you continued the EMT program, you went upstairs and took phlebotomy, now you can start IVs at the EMT level. Your medical director of the service can actually authorize you to do so, but it will be under stringent guidelines, and it will be under strict kind of one-on-one time with you, that he sees your performance, he acknowledges that you can do it appropriately and properly. I mean, there's a slew of things he's gotta go through, but yes, eventually he can sign you off on something like that. And that's very much the case in the rural areas, especially down there in Randolph County and stuff like that, because again, whenever I started in EMT school, I could give IVs, I could give normal saline, I could give D50, I could do a lot of things until they converted to National Registry, and then they took all that away from us, which I thought just blew our foot right off. Because down there in the rural areas, they could use techniques like that and things like that, and they don't. So again, some of those things that you have to kind of review. So just know about drownings, the pathophysiology behind it. Not so much about the care, because in this particular instance, we normally call resources to bring the patient to us, just like in extrication of patients from a vehicle. So we're just like, okay. So understand about diving, the bends, if you will, decompression sickness. So know about that in general. I'm not asking you to break down type 1 and type 2. As a general patho, you need to know decompression sickness and bends and the fact that the patient's gonna need a hyperbaric chamber for treatment. Okay? The last chapter, I think, is over psychiatric emergencies, so pay attention to the following. Bipolar, depression, schizophrenia. Understand the difference between agitated delirium and dementia, thank you. Those are two separate types of
Dementia versus what?
issues.
I didn't catch that. What's dementia versus?
What, delirium.
Thank you.
Know about PTSD, okay, because that's running rampant among our, not only our military, but teenagers and stuff like that.
What about, last time we took paranoia, that's the only thing.
Paranoia, yep.
Oh, and, types of consent involved with those too.
Yes, especially those that are altered mentally, yes. Okay, so in your book, for future reference, you will see this again, tardive dyskinesia. You'll need to know that, come for it, come
Pardon, what?
793,
Say that again?
tardive dyskinesia. It's under the extrapyramidal syndrome, and it's like the last one of the first column. You will see that again.
It's not hard, yeah.
It's not for the test, you will see that for National Registry. All right? Yeah, so you definitely need to know the different types of consents when dealing with psychiatric emergencies. And just understand that these particular patients, it is of your utmost importance to pay attention to the signs. I'm not so worried about the one that's more verbal, more physical, if you will. I'm more worried about the ones that are sitting still doing this number. Or they're constantly looking around, because they're about to jump on you in a heartbeat, okay? It's the quiet ones you need to be concerned with, okay? The physical ones, the verbal ones, they're already showing you their disconnect, if you will, okay? That's very obvious. It's the ones that are doing this number, you need to be very attentive about. Ones that are doing something repetitively, you can even hear them grinding their teeth sometimes, or they're just sitting there and they're just constantly looking around. Okay, these are the ones you need to pay close attention to, because they'll be the first ones unexpected to try to whoop your, okay? Know the rules to restraining a patient. Okay, highlight that, know that, star it, whatever. And that's pretty much all of the chapters.
I've got written up so far, it's already like 10 pages. How far did you get on the other one before the incident?
I'm at 10.
Yeah.
Okay, so again, it's just a matter of, this is what I
What incident?
always tell my
Yeah, I missed.
students when you go to study for an exam, especially a
Oh,
final
okay.
exam.
Study guide.
Okay?
Oh.
If you will briefly skim your chapter and look at concepts, such as, okay, I give you concept, okay, respiratory system. There's a concept you need to understand. The concept of respiration and ventilation. If you understand that and how it works, then you'll be able to apply it to an asthma attack, or someone with emphysema, or someone who's just having an anxiety or a panic attack, or let me rephrase that, hyperventilation syndrome. If you understand the concept and how the body works normally, when it becomes outside of the norm, you'll know how to apply it. Does this make sense? So go through your chapters and look at concepts. pay close attention to, like the anatomy and physiology review, as well as the patho behind, because they give you that as a preview before they go into a disease process or a disorder or something that kind of pulls your attention. So pay close attention to the anatomy and physiology review, and then once you start into the disorder, you'll understand and how to relate it back to, okay, well, if this is normal, then now I understand why this is abnormal and why they present the way they do, signs and symptoms wise. I'm just gonna be straight up with you. You better know them drug cards inside and out. Because it may be a regurgitation of, okay, you have nitro, I wanna know everything there is to know about it. You better regurgitate that card you just filled out. That's like I had you do it. I had you do it as a team, I had you do it as a group, and then you did it and kind of made a couple of adjustments, okay? You need to know them drugs inside and out. Because if you look at it from this perspective, and I'm setting you up for success in the future, if you continue in this world and want to go to the advanced class, guess what you're gonna have to know inside and out?
More drugs.
The same drugs you assist your patient as an EMT are the same drugs, plus a couple, that you are now responsible in giving, which means you don't have to necessarily have a MD's permission because of the protocols you fall under. So if you have a good idea now of what those are, then you will be well prepared come advanced class. These are the chapters, okay, medical emergencies. It's a matter of knowledge application. If I give you a scenario, can you pick out the abnormalities? And then can you explain the pathophysiology behind the diagnosis that you are giving this patient in the scenario? And then explain to me your treatment and why. You have to understand why you do what you do. I'm not pushing out cookie cutter EMTs. I am pushing out independent critical thinkers when you leave my program.
I'm actually here to just drive trucks.
I know, ambulance driver, okay? All
They
right.
told me it was 25 an hour, I couldn't say.
I know, right? Just saying, okay? Because if there's any paramedic that's out there in the field, I'm a firm believer, I'd rather have a good trainable EMT next to me who knows their stuff than another paramedic I'm having to butt heads with. Because I can train you the way I need you to be in order for us to work as a team. And that, and for those that don't, I'm so sorry. Because they are using a vital resource right next to them and they choose not to. And I'm here to tell you, I couldn't do it by myself out there in the field, except for whenever I was in the back of the ambulance by myself, that's different. But on the scene, when we had a critical patient and my EMT knew what my next step was gonna be, oh God, it was great. We were up and out of that scene within like 6 minutes. But for those that don't, I'm sorry that you're not being utilized as well, other than a gopher. And to me, that's an insult. It really is. So I apologize if you actually get out there with a service and they don't utilize you to your degree of your learning. Heck, man, I'm teaching you other stuff, okay? So it is 10 till, let's break, get back here at like 1. And then we're actually gonna be in